and this morning, after an early start,
Okay.
Hey, Devon.
Hi, good afternoon, everybody.
Hello.
Hope you're all well
Yes.
Yeah, we're not too bad.
and pain-free today.
A little bit.
Yeah, I think that the majority of the times we do carry a little bit, but again, it's about boosting our immune system as much as we can, using as much natural product, natural things that we may have in the kitchen right now. Normally, I like to have a bit of ginger around this time of the year. I like to not chew, but to have a bit of ginger, about that small, in my mouth. And it helps with the throatiness, you know, that feeling you get in the back of your throat. That feeling that makes you feel like you want to cough. But that's just leading up to a normal winter situation. But has anybody been practicing anything that we've been talking about?
Yeah, I've been doing some massage with Tiger Balm on sore ankle. So that seems to be okay.
Mm-hmm.
Seems to be, and I have invested in some magnesium oil, but I haven't some spray, but I haven't tried that out yet.
Right, it's a wonderful product.
Where you got it? I want to get it.
And
Where did you get it, Andy?
I got it on Amazon.
Oh, okay.
Comes in various to various costs. I got a spray.
Yeah. Several people have recommended that to me as well.
Yeah.
Yeah, I got mine from Holland and Barrett.
Oh, Holland and Barrett. Yeah. Yeah, yeah. Okay. Does it work, Farouk?
I don't know.
how long have you been using it?
He hasn't tried it yet.
1 week.
Oh,
week.
okay. Okay. Okay.
1
Okay.
week is short in politics.
Yeah, indeed. Devon, if you've got stuff like Tiger Balm or magnesium oil, you don't use them different times of the day, not together. That might be a bit of too much of a concoction.
Well, I tend to use them together,
Okay.
but you can use them different time of the day, because again, it's what works for one person. So it depends on the individual. But for myself, I tend to use at night and first thing in the morning. But as you're going along through the day and you've got aches and pains, by all means, give it a rub in and see how that feels. Or using the Vicks Vapor Rub with it to warm the area up. But also, not just about warming, I have to come back to using cold compress. You know, it don't agree with some people. Some people find that the cold is just too much. But I find that using the cold, after you get over the initial shock of the cold for the first minute or so, then what happens, it numbs that area. And I rub into, so normally if I'm rubbing oil into my body, into my skin, I like to use heat when I'm doing that. So it helps the body to absorb it easier. When I'm trying to get swelling down, I use the cold compress. And at any one time, I'll have 2, possibly even 3 cold compress in the freezer. So at any time, if I strain something, or if my knee's coming up where I've done a bit of walking or whatever it is, it's straight on as quick as possible. And then I rotate them over a period of time. And again, it comes down to lots of fluid in the body. So especially water, the body don't have to break down water as such. But if you're drinking fluid, tea, other stuff, it has to break it down. It has to separate it using water. So my 2 favorite drinks, water and coconut water.
Oh, yeah.
Right. That helps me a lot, especially to rehydrate. But celery is very, very good.
Yeah.
I don't particularly like the taste of juiced celery, but I do drink it. I do juice it sometimes, and drink that when I need to feel rehydrated. But there's just so many things that we can do to help ourselves. The stretching, the walking for half an hour, but it doesn't have to be a straight half an hour walk. It could be 15 minutes to the park or wherever you can. Have a sit down, have a look around for an hour, half an hour, whatever. As long as you get that half an hour in to exercise, to stretch out, and then that takes you to that point of stretching out. So you can walk to the park, be in the fresh air, park bench, and just do some stretching. You put your foot up, if you can, stretch it out, stretch out your lower back. And for those people who are not at work or past that age where we got our freedom, then we can do that as part of a set routine, where certain days you stretch it out. And of course, doing the breathing exercise. And I think that most of us have an idea of what Tai Chi looks like. So even if you're not doing it perfectly, it is to do the breath in and you hold and you breathe it out. So you're exercising the lungs, exercising the body, moving. And it's so great because it's not just your body you're exercising. And it's not just your body you're bringing a feel-good factor to. It is also the brain. So the breathing. Should we do some more stretching on the breath? A bit of stretching out with the breath, and then we come back to deal with specific pains if we can. So if we sit comfortably, and if we use the arm movement to stretch and to breathe. So it's breathing in, and just hold it for a second, and you're out. You can do that through your mouth. So exhale through your mouth. And again, so it's breathing in through your nasal passage and stretching it out and out. Long breath in and long breath out. So and out. Now let's just even it up. So the left side. So as much as you can. And out. And again. And hold. And out. And one more. And hold. And out. Exhale. Now, as you're doing that, is to become aware of the breath as you breathe it in. So you're becoming aware of yourself, how you breathe in, and to feel that air in your lungs. And as you breathe in, to feel your stomach going out, your belly going out. So it's in and out. The oxygen is, as you know, is vitally important. But as you're sitting down, to be able to move different parts of your body, say for instance, a lower back, and even if you're just moving your lower back just a little bit, just to move, to rock in your chair as much as you can without too much pain, without too much ache, just to move. So as I'm sitting, my upper part is straight and I'm just moving my lower body, my hip, like you're dancing in the chair basically, but very slowly. So you're just moving. So you're moving and exercising the hip as much as you can to keep it as within your comfort zone. So within your comfort zone.
Thanks.
Yeah.
It's movement.
Okay. Is that okay? Right. And again, because there's a lot we can do from a seated position. So it is opening up the spine by bending your head forward. And as you go down, so you're trying to keep your upper body straight and you're just moving, stretching it out. And then allow your body just to lean a little bit more forward. So now you're curling the upper part of your spine gently. And you just hold. And then to put your hands on your thighs and push your body back. And just to push your body back up into the upright position. Okay, some people may feel a little bit giddy. How do you feel? Okay.
Okay.
And if we just do that again, just one more. So everything is gently, very slowly, stretching it out. And again, pushing your body back. So you can do that, or you can do that with your arms extended, right? Seat as you're seated, and you can just do, and you go forward. So you just go forward, and you're stretching out, and slowly come back. But everything is done very, very slowly, so that you can feel, if you're feeling something that's pulling, that means you reach your limit. And it's not to go past your limit, because we don't want to extend into a situation whereby it's just too much. And that's why we're doing it very, very slowly. So it's slow movements. So even when you're doing the exercise like that, stretching up, that's slow movement. Everything's slow. Okay. Now, we were talking about the pain. I think last time, did we mention CBD? I think we did, didn't we?
Yeah, we talked about the
Yeah, we
different
had-
strengths.
We did. Oh, right, we did.
That's all right,
And we talked about different groups, different percentage and stuff.
Yeah.
Because again, to control the pain or to get some respite, because that's the thing that we're looking for, is how to best live with the pain, rather than to be frustrated that we have the pain and not getting rid of the pain. So guided imagery and visualization, or visualizing. So to put ourselves in a situation where we can relax our mind, become totally at peace, letting go, basically. So the different things we can do or implement. We touched on the massage, which we'll come back to. And so massage, acupuncture, Tai Chi, if we can, to reduce our weight, and CBD, physical therapy, basically. So exercises as well. So, we may think that we're not in a position to be able to exercise, but we are, because even if it's just wiggling your ankle, wiggling your foot, right, on a regular basis, and doing that deliberately, doing it with intent, because that is your exercise, then that is it. You do that. So whatever it is, and especially if you can get some kind of respite by doing that. But again, we come back to using heat pads, using cold compress,
Straighten your leg down.
using various oils.
I'll put your foot out here.
Yeah. And
Let me move. Look, David,
Yeah, yeah.
there's more space.
Sorry, I'm gonna go up.
Sorry, David.
Let's get the little boy's room.
Has to go to-
all right, Dave.
Yeah.
And
Oh,
it's,
What about the balance, Devon, between exercise and rest? I mean, is that very individual?
it's very individual, but the body needs to recover, right? So I know some people who I think exercise too much, right? It's like everything else. There has to be a balance, and the body needs to recover. When you exercise, you go out, you have a great workout. Then I would say, especially unless you're building up an event, then it's to give yourself a day or more. It depends on how much exercise you're doing. But I will always say, give yourself a day or give yourself the weekend off. Because I know some people who really, really take it very serious. Well, everybody takes it seriously, but really get into it. And they do really heavy exercise right the way around the week, through the week. And I try to get them to give their body a chance to recover. Their body, because to build muscles, you're damaging the muscles so that they repair. When they repair stronger. So what you're building up is scar tissue within the muscles. So it is about having going and having a massage, doing stretching, doing stuff like a sauna and stuff like that, but also using the exercise, because people exercise for different reasons. But yes, I think that we need a recovery time between exercises.
Good.
And doing, having drinks. And when I say drinks, sorry, drinking water, because alcohol can have the opposite effect, especially on pain. And we may think it's easing the pain at that particular time because it's numbed the feeling or you're not feeling it anymore. But it is weakening the body's ability to heal itself. It's damaging your immune system because your immune system is engaged whenever you're drinking lots of alcohol. I'm not saying don't have a tipple, right? Because at some stage we like to have a tipple, but it's about excess and having and doing everything in moderation and to become aware of our own body, our own body's need. So coffee, I don't drink, even though I love the smell of coffee. Alcohol, yes, I do drink alcohol, but very, very small amount at a time. It's great if I have a Christmas party because when people bring the bottles, they stay for a very long time. So it's like my supply for the rest of the year. But it is important that we have that balance between what we like to do and what we need to do for the body. So the walking, and for the recovery, it depends again on the extent on how much exercising you do. If it's very light exercise, then yes, you can be doing light exercise and different parts of your body. So if it's a gym that you go to the gym and you're doing leg presses, and then next time you go in, you're doing your upper body work, again, you're not working as much the same muscles all the time. So it's about being aware of that. And also the understanding of jogging and running opposed to walking. Walking is fantastic. It's really good for you. And walking with intent, because with some people with bad knees, the jogging is not very good. It's just too much impact. And again, when you're doing that, is to have that realization that, yes, you're not doing your joints any favor. So it is ensuring that you have turmeric, ginger, things like that in your body, in your system. Because I think a lot of times when people try something out, they'll try it out for a few days and say it don't work. But it's about it being in your system. So is anybody using or trying anything out at this moment?
Have you tried transference?
Sorry,
Transference. We
Trans-
had a lady who had a back problem from the time she was 6, and she learned to transfer the pain. Actually, on our radio program, there is an interview with her on ELR, and she was able to transfer the pain from herself to something else or somebody else in her mind. And she said it did help. It wasn't perfect because she still did her physio and all the other things, but it was the only thing that made the pain bearable.
I know what you're talking about, but with me, it tends to happen the other way. I tend to get other people's pain, but all what you're saying there is perfectly true, because there is so many different ways. The brain is so powerful. When I'm tired and I need energy, sometimes by touching the wall, placing my hand on the wall, but what I'm doing, I am visualizing that the energy that I need, because energy is all around us. But what I need, I can feel it coming through the wall, or I place my feet on the ground and visualize the roots of my feet going down into the ground and exchanging the energy. There's a thing that we did some years back where it's about cleansing the energy in the body. So you're exchanging that energy through the roots of your feet. And it is about visualization. It is about, but I think in that particular time, I think that was in coordination to, oh gosh, I can't remember what it was. It could have been something to do with regression we were doing or something anyway, but it was along that lines, because there's just so many things. And our brain is such a fantastic tool. It is about using it as that, because the same way that we can attract pain, we can also repel it. We can let it go. And that's why a lot of times when when I'm doing relaxational technique, I'm saying, let it go, let it go. I'm not sure if everybody understands what I mean is that when I say, let it go. But it's about letting go of the pain, but you have to relax your body. You have to allow your body to be still. But just the same way, I think that Diane is absolutely right. I don't know if you've ever tried, it, you know, it goes along the line of faith. So it's about having faith that it is going to work and having that belief. So it is about anchoring that within spirituality, because we're not just a physical being. We are a spiritual being. We're physical and spiritual. So it's going along the spiritual line and to be able to let go. And that's why in some situation, even when somebody strokes your arm, you've got a painful arm, and if you have that enough belief in what they're doing, is to let that pain go. You know, there's some really wonderful things that we've done over the years, even to do with trauma, but pain is trauma. where we've allowed that pain to, or the trauma to come out of your body. But it's about the individual. It's about how you view what is happening. So seeing that we're going along that line, then have you ever used Reiki?
Yeah.
Yeah.
Yes, yes.
So again, there's various types of Reiki. I practice a thing called One Energy Systems of Healing, which uses Reiki. Now, if you like to, does anybody else try Reiki or understand what is Reiki?
Yeah.
Yeah?
Mm.
Because we all use it. We all use Reiki, but a lot of us use it passively. We use it without knowing that we use it. And the idea is to use it with intent. So, say for instance, I mean, would you like to just go into Reiki a little bit?
Yeah.
Okay. So what I'm going to ask you to do is to get your hands about that much apart and just move them gently in and out. Have we done?
We did. You did that last week. The touching close together and
Yes.
the energy that you can feel in between.
That's right. So let's use that energy to heal wherever you've got a pain right now. If it's not too difficult to reach, now that energy that you're feeling in your hands, are we all feeling that energy? Yeah, just give me a nod or a yeah when you're feeling it. Yeah, that spongy feeling, like a magnet.
Mm.
It's a wonderful energy. That's the energy that flows through your soul. Every being, every animal, plants, that energy is there. It's the earth energy. Now, let's just use that energy now and place it wherever you can on yourself or the person next to you, if you wish. So to use that energy, but use it with intent. So you can feel that warmth, you can feel that heat. Now put that on your body or on your partner and allow that heat to reach the aches, the pain. But what I want you to do now is to have that intent that what you're doing, you're healing that pain, or you're going to shift that pain. You're going to see that pain go down your body, your partner's body, down through the legs, into the floor, into the ground to be cleansed. You're allowing that energy to leave your body. You're healing their body. And for the receiver, just to become aware of that heat, that energy, and allow it to flow through your body, like your body is accepting it. And if you're doing it to yourself, to allow that energy to flow through your body and then out through the floor into the ground. Because when you're doing that, it's recycling. So you're having positive chi, positive energy coming in, the aches, the pain, the negativity going out. And the more you allow yourself to be peaceful and calm, it's the more that energy flows. Just letting it go, letting it go. And still using the breath. So it's a long breath in and out, dropping your shoulders. Wonderful. That's it. Just letting it go. And you can do that anytime, any place. And just think of the words, letting go of the pain, whatever words you use, or if it's a prayer, then you use those words, whichever suits you better. It's our energy, it's your energy. There's no right or wrong way. Just think of it in a positive way. Okay, so 1, 2, 3, you can come back. How did you find that?
I could feel the heat. I felt it hot.
I felt it was vibrating.
Really, I could feel it pulsating.
Yeah.
I could feel like throbbing in
Yeah.
my hands.
Yeah.
I'll do it for you.
So how is that for you? I mean, was that comfortable doing it?
Yeah.
Yeah, David noticed a difference.
Good. And is that something that you'd like Diana to do, David?
Yeah, it'd be nice to have another go at it.
Sorry?
It'd be nice to see how she gets on
Okay. There is a trick you can do
with
with
my
that.
spine.
Yes.
Diana, there's a trick. Diane, there's a trick you can do. Just get a little bit, again, I'm not a Vicks addict, but rub some Vicks in your hand, right? And then do it. And it doesn't matter if you're doing it through the clothing or on the skin. I don't know if it's in my mind, but after I've done some work with Vicks, and I'm doing working with a client using energy, it could be in my mind, but I think it's for real. It feels so much warmer, hotter, basically. And that's the heat that you're going to use. That is the energy that you are using to heal.
Mm.
Yeah. So anywhere on the body, the knees, the head, it's like if you've got a headache, you're not feeling well, or you can be just under the weather. And again, it is just shifting that energy. But I don't know if you've seen in some cultures, when there's trauma, people do that. And it's a natural thing they're doing. But also, it's healing. And if you do that, when you're not well, or if you have a headache, and again, it's soothed. You do that and you're shifting away that crowded feeling, that negative feeling. You know, it is fantastic. We have so many tools. It's just to remind you of them. Because I think that over the years, we forget some of the tools that we have, and they're natural tools. But it's to couple that with A, whatever the doctor is giving you, B, the natural things that you can buy basically at supermarkets, but even also greengrocers, the food that we eat. You know, tomatoes. Okay, tomatoes may be too acidic for some women, but for men, every man should have tomatoes. I was going to say on a daily basis, but I would say not far off a daily basis because of our dreaded prostate cancer. There's an enzyme that the pharmacy has taken out of tomato and then sell it back to us. Yeah, and they sell it back to us instead of telling us, eat more tomatoes.
Is that
Right?
lycopene?
Yes.
Yeah.
And it is, you know, it should be up on all the billboards. Eat tomatoes. Have tomato sauce. All right, there's a particular way of eating or doing the tomatoes. What I do, you know, when you poach eggs, right? What you do, you just get the tomato, boil in hot water, drop it in, so that you can release the skin. So you can just slide the skin off. But what that's doing is actually releasing the enzyme even more. But yes, raw tomato, but anything, tomato in a tin, whatever, that helps so much. And, you know, it's not a thing that we've been taught. We should be told about turmeric. We should be told about ginger. But okay, we're telling ourselves. But there's just so much more we can do. And it's just to have that bit of understanding that eating the food in a certain way or using the food in a certain way can help us so much. You know, by juicing some things, using pepper, really hot pepper, to stimulate your immune system. You know, some people don't eat spicy stuff or don't eat pepper. Pepper is good for you. It stimulates your immune system. So this time of the year, there's a drink that I make and it's got loads and loads of stuff in it. And I put it in the fridge and I have little bits, little shots of it, but it's all about your immune system. It is all about helping with the aches and pains.
To be honest, when I went to India, I mean, obviously, I know that spices and things are really good for us, and you know, a lot of them have different kind of properties in them that are really helpful, like anti-inflammatories and things like that. So in our cooking, we always use like spices anyway, but also I've heard about the ginger and the turmeric. Seems really popular now as well, turmeric. Like they're making the tablets and available to people. But like you say, you can go and buy the actual raw products and just go online and find out different ways of using it in your cooking and things like that. But someone mentioned to me something called spirulina. Have you heard of?
Yes.
What is that exactly?
Spirulina, gosh, it's a plant, I think, but I think I've had it in tea. Oh my gosh, I can't put my finger on.
Well, maybe I'll have to look it up so I can sort of because he has it every day and he says, oh, it's brilliant, it's great for your health, it's helps you in so many ways. And yeah, he really swears by that spirulina.
You know, there's just so many things.
Yeah.
You know, I think I showed you the teas that I drink.
Okay.
And there's just so many teas. And, you know, all right, some of them is not the best tasting tea. like neem. Neem, it's a plant, but it's extremely bitter. I think it's the most bitter. It's, you know, even bitter than a thing called cerasee that we have. Right. Bitter melon. I think, does anybody know what bitter melon is?
I've heard.
Yes, I know. Ampalaya.
Well,
it's not one of my favorites.
When I can find it, I use it in my cooking. I chop it up. And a lot of times when you go to an Indian restaurant, you may be eating bitter melon, but you're not really aware of it because it's not as much in there, or it's hidden with other spices. But also that is very good for you. And we tend to stray away from bitter and we go towards sugar. When sugar, apart from giving us a quick jolt of energy, it's not doing as much as I think the bitter stuff does, and roots. So it is about, you know, creating that balance. I have lots of bitter teas because I need to keep my sugar level balanced. I eat a lot of weird and wonderful fruits or vegetables. Again, probably I wouldn't eat it normally, but it's because it is about balancing my sugar level. Also, using meditation and stillness, again, to slow ourselves down, slow our bodies down, slow down the way that we live our lives in this extremely pacey time that we live in. You know, because even when we're supposed to be calm and still, our brains are racing, our minds racing. You know, it's just not enough time in the day for all the things that we want to do. But it's about that stillness, just a siesta for the brain, basically, where we take things easy, slow it down, and to be in the here and now, to live in the here and now. Because I'm sure that many of us right now, we're in the room, but our mind is somewhere else. You know, we're fixing something, we're doing something else, or we're thinking of the next event, or the next workshop, or the next whatever, next session. But it's vitally important to shut things down in a day, 5 minutes, 10 minutes, and just to be. And sometimes just even looking around the room, just looking around the room, just looking at where we are, how we are, and to be still, gently. It's a wonderful thing, but it is being in your body, taking away the aches, taking away the pains. Be still. Like sleeping. Okay, sometimes we find it difficult to sleep, but when you're still, your body's mending itself. When you're sleeping, the body's mending itself. If you can, go to bed at a good time so that you can sleep. And if you're finding difficulty sleeping, there's a lot of natural things that you can use, including the breath. So it's the long, calming breath. Bringing peace, bringing tranquility into your mind, your body. Okay, so is there any question that you'd like to ask? Is there anything you'd like to say? Anybody?
I looked up spirulina. It's blue-green algae.
Yeah,
Yes.
yeah,
Yeah.
he drinks that every day, every day.
Who?
Someone I work with at the library, so he's all into, like, he comes to work with all like peas and pulses and all like organic-y things. So he's always, every day he always has his packed lunch, and I'm sitting there with my sandwich and, you know, crisps or whatever, and he's got his lovely sort of, it looks really nice actually, but I still don't feel like it. Take a while to get into a habit of eating that way, you know, trying to eat more pulses for
Is he
me anyway.
vegetarian?
But yeah, it looked really good, and he swears by that drink. He sent it to me, emailed me all these different things, and you know, I said, oh yeah, I will try. But it's like old habits, you know, takes time. Everything takes time to change anyway. So it's got to be a slow process. But yeah, a lot of people I know do swear by things like using turmeric and ginger. And I must admit, I had a really bad cough years ago, this was, and I was in having my nails done, and I was coughing a little bit, and the lady disappeared, and she came back in with some ginger tea that she had. She was from Thailand, and she had this little sachet of ginger tea, and she just made me a little tiny cup. And as soon as I had some, then I just stopped coughing, sort of like, felt like straight away, to be honest. And after that, I felt, yeah, ginger is definitely something that's really helpful. And I know it's an anti-inflammatory as well. So, you know, I guess these things, you know, it's just that we're not that, it's only now people are becoming more aware of like alternative therapies and things like that. So it's becoming quite popular now, I'd say, but previously we didn't, like, I never really thought about it, to be honest.
Well, almost
So-
all of our proprietary drugs came from plants.
Well, exactly, yeah. Yeah, definitely. Because places like India and all other countries, you know, they were always using those sort of things in their healing, like, you know, with leaves and things like that. They still, I know my husband's aunt, she had high blood pressure. And I don't recommend it, but she was using these leaves and she was chewing on those for years. And it wasn't anything, I think it was a herbal leaf that's, you know, nothing dodgy or anything like that. It was a proper healing leaf or something like that, that they used for that kind of thing. And it kept her blood pressure quite down quite well. And she swore by that. And, you know, she always did use that. So I'm not saying it is good. It's possible it affects people differently. So, you know, but definitely, yeah, like you say, Diane, it all comes from the leaves and the things, all these drugs. But the thing is, they add other things to it, and you know, that's when it's not as good for us, I guess.
Beetroot is very good for high blood pressure.
Sorry?
Beetroot,
Oh, is it?
good for high blood pressure, yes.
Oh, that's good. That's good. Yeah, it's good to know.
And you can eat the leaves.
You can.
You know, I think
Oxalic acid is in rhubarb.
originally,
Yeah, they go in the salad, don't they?
Yeah,
Can't hear, Devon, you're frozen.
I think it's orange.
can you hear me?
Yeah,
All right. No, it's when the lady was talking to me, I couldn't see her. I can only see four
Oh.
people. I'm using the small computer at the moment.
Oh, that's all right.
We try not to call us, you know, call it alternative.
Oh, I know what you mean. It's a different kind of thing.
Well, we call it complementary. So all what we do is complementary because many years ago, it feels like 100 years ago, our practice was called complementary. Sorry, it was called
alternative.
alternative.
Okay.
And the medical fraternity hasn't forgiven us yet, even though we're called complementary. And it is complementary. It is whatever it is that the doctors have asked you to take, right? Because it is just that. It is about working with both. I know that some people like to use it alternatively, but I would say that it's very important to understand or to listen to what the doctor is saying to you, but also, on the other hand, what we do as complementary health therapists.
Yeah. Okay. Yeah, I get what you mean. It used to be called that, alternative, and I think it was because they weren't very keen on the idea at first, were they? The doctors. I think it's becoming a lot more accepting because a lot more people are interested in it, to be honest. So,
that's true.
Yeah.
You know, in our centre in Forest Hill, we do see a lot of doctors and nurses. We see a lot of nurses anyway, but we do have doctors who come along, but some of them, they don't like to disclose that they are doctors. They don't like to say they're doctors. They just come along and, you know, during the course of a conversation, it then gets revealed that they're a doctor. But it's really good. It's good that doctors are finding that complementary health works just as well or even better in some cases with some people.
Great thing. At least people have choice. That's a good thing, you know.
That is it.
Dr. De Brera will be giving he's hosting the session tomorrow. He's a retired consultant rheumatologist, and he was always happy that I did complementary, as long as we put it on our notes.
and the girl with him was doing diabetes, isn't she?
Yeah, and there's a lady who's going to be, she's a consultant in diabetes. So that's tomorrow at 3 o'clock.
Oh, good.
Okay, so can we do a exercise to finish off today? A breathing exercise.
Yes.
the roar. Yeah. So it is a roar. So I'm going to ask you to roar like a lion.
Done this in yoga.
Yeah.
Done this
So-
sort of thing. Yeah.
What we're going to do is to, if you're standing, to bend your knees, but if you're sitting, just to bring your arms up, and as you bring it up, you breathe in, and you're going to roar out. Roar!
Gets
And
it all
again,
out.
It's the three lion roar. So
Mm.
it, and again, up,
Oh, we've got to do it again.
it's 3 roars, and it's like, ready, roar! And the last one, last roar, as we come up, long breath in and out. Roar!
That's a good one.
Thank you very much, ladies and
Good way
gentlemen.
to end. Yeah, thanks a lot,
Thank you.
Devon. That's great.
Yeah,
Cheers.
thanks.
To everybody.
Thank you.
Yeah, as Diane was saying, we've got a patient education forum tomorrow at 3 o'clock with Dr. De Brera, focus on diabetes. So hopefully you can join us for that.
Mm.
And Andy's next yoga class is on Thursday this week as well. So we've got a busy week this week.
And Saturday.
And Saturday as well, yeah, got a double session on Saturday for the coffee morning and IT clinic. So if you've got any queries, then put them in Sam and he'll have a look at them for you.
Okay.
Okay.
But,
Right. Thanks, everybody.
thank
gotta
you.
go now.
Thanks. Take
Thank
care,
you.
everyone.
Bye for
Bye.
now.
Bye, everybody.
Take care, Phil. Bye.
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 Bye. Where's to leave the session? I can't see.
You go to the top, bottom.